The population of a country is its most precious resource, and for that population the most precious resource is its health. And so it's really important when we are growing into older age that we maintain the health of the public as long as we possibly can. And we have a lot of information on that now from the longitudinal study, which is called TILDA. And most older people think that their physical health is very good, and they also think that their mental health is very good. However, when studies look at that more closely, they find that actually there are a lot of issues for concern. So, for example, a third of our older population, aged 50 and over, are obese, and a further 43% are overweight. So that is a major concern for all of the health issues that come with those. We also know there's a very high prevalence of other chronic conditions, and maybe the best way to capture that is by considering the percentage of the population who are taking medications on a regular basis. So, and I'm just going to look at my numbers here. For those aged 50 to 64, about 1/3 are taking 1 or 2 medications on a regular basis. Now, I would expect people aged 50 to 64 to be very healthy, but actually they're taking regular medications. Nearly 1 in 5 are taking 3 to 4 medications regularly, and 1 in 8 are taking 5 or more medications on a regular basis. So instead of the conversation focusing on the cost of medications, we really need to be asking, why are so many people taking medications, and what can we do to delay the onset of those chronic conditions so that people are not just living longer, but that they are living healthy lives for longer, that they're adding life to years. The longer people are healthy, certainly the less that impacts on the health services, particularly on the community care services, on the primary care services, where most chronic conditions should be managed and indeed managed very much in association with the individual. The problem for us is that many people haven't just got one chronic condition or 2 chronic conditions, they've got several chronic conditions. So in many ways we're in the worst of all worlds, where people are living longer, which is really good, but their health is not what it could be. We know from the many ways in which we have changed lifestyles, we have greatly brought down the death rates from heart disease and stroke, for example. We know we can change lifestyles. So what's really important now is to change attitudes, that it's not okay to start getting sick in your 50s, it's not okay to be obese, it's not okay to be sedentary. Actually, you'll feel much better if you're active, out there, socialising, meeting people. You'll feel well with that different way of thinking about ageing. We've lots of good role models, and the challenge for us now is to make sure that people across society, including those with lower levels of education, less access to, say, healthier food and nutrition and so on, that everybody benefits from the possibilities of living longer, healthier lives in Ireland.